sounding good on our end. Thank you very much. Et pour le ministre, si vous avez réglé le problème, on va réessayer. Sinon, on va continuer avec ce qu'on avait.
Oui, malheureusement, de notre côté, on a seulement les casques sans fil. Les réglages semblent tous indiquer que c'est le micro du casque qui est en train de fonctionner. Donc, je ne sais pas pourquoi on n'entend pas le tap sur le micro tel quel.
Des fois, c'est des suppressions automatiques dans le casque. Il va couper.
OK, d'accord.
Taper, ça se peut, c'est ça. Là. Mais regarde, on va aller sur ce qu'on a. On commence dans les prochaines 2 minutes.
D'accord.
Si vous voulez laisser le ministre s'asseoir.
Oui.
Donc, est-ce qu'on m'entend? Le technicien va le dire, j'imagine.
Merci. Oui, on vous attend très bien. Et,
donc, vous m'entendez bien?
Vous pouvez transférer la ligne aussi. On vous attend très bien.
D'accord. Parfait. Donc, je vais transférer la ligne maintenant et enlever la musique. Merci.
This conference is being recorded. Cette conférence est enregistrée.
Hi, everyone. Thanks for joining us today. My name is Dylan Robertson. I'm the Ottawa Bureau Chief for the Winnipeg Free Press. We've got our panelists here today. They'll be joining us. This time around, we're going to get each of them to introduce themselves when they start to speak, and then we'll throw to questions afterwards. We'll use the raise hand function on Zoom to take the priority questions for the gallery first before the other ones. And I understand that we have a hard stop for 3 p.m. today. So could the first speaker please start and introduce themselves?
Bonjour, Dylan, et bonjour à tous et à toutes, and good afternoon, everyone, wherever you may be. Très heureux pour moi de vous joindre à vous à partir de la magnifique ville de Gaspé, en Gaspésie, dans la circonscription de ma collègue Diane de Boutillier. Avant de commencer, j'aimerais saluer la docteure Theresa Tam, administratrice en chef de la santé publique, ainsi que Mme Laura Sauvé de la Société canadienne de pédiatrie. Merci à toutes et à tous d'être avec nous aujourd'hui pour réitérer l'importance de rester à jour dans sa vaccination. Maintenir une vaccination à jour est la clé pour continuer de nous protéger et de protéger notre famille et tous ceux qui nous sont proches. Vaccination saves lives, which is why safe, effective vaccines are now available for everyone in Canada over 6 months of age. And booster doses are available for everyone over the age of 5. Ce matin, Santé Canada a autorisé l'utilisation du vaccin bivalent de Moderna contre la COVID-19 comme dose de rappel chez les adultes de 18 ans et plus. Un vaccin bivalent est un vaccin qui cible 2 souches virales différentes. Le vaccin autorisé aujourd'hui cible ce qu'on appelle la souche originelle de la COVID-19 ainsi que la souche Omicron. Il s'agit du premier vaccin bivalent contre la COVID-19 dont l'utilisation est autorisée au pays. Tel qu'annoncé ce matin, le Comité consultatif national de l'immunisation, le CCNI, continue de recommander l'administration d'une dose de rappel cet automne. Dans la mesure du possible, cette dose devrait être, pour les personnes de 18 ans et plus, une dose de rappel d'un vaccin bivalent ciblant le variant Omicron comme celui qui est autorisé aujourd'hui. Ceci dit, tous les vaccins autorisés jusqu'à maintenant continuent d'être sûrs et efficaces. De plus, 780 000 doses de vaccins bivalents Moderna arriveront demain au pays et un total de 10,5 millions de doses seront livrées d'ici la fin septembre aux Canadiens. Ces vaccins seront rapidement et gratuitement distribués aux provinces et aux territoires. Let me repeat this in English. This morning, Health Canada authorized the use of the Moderna bivalent COVID-19 vaccine as a booster dose in adults aged 18 years or over. A bivalent vaccine is one that targets two different strains of a virus. The vaccine authorized today targets both the original strain of COVID-19 and the Omicron strain. It is the first bivalent COVID-19 vaccine to be authorized for use in Canada. As we also heard this morning, the National Advisory Committee on Immunization, also known as NACI, continues to recommend a booster this fall. Where possible, for those 18 or older, that dose should be a bivalent booster that targets Omicron, like the one that has been authorized today. This being said, all vaccines approved until now continue to remain safe and effective. In addition, 780,000 doses of that new bivalent vaccine will be delivered to Canada tomorrow. A total of 10.5 million doses will be delivered by the end of September. As usual, these vaccines will be delivered quickly and free of charge to provinces and territories. Let me also speak about the importance of this fall's vaccination campaign. This fall will be challenging with the return of the flu and other respiratory diseases and people moving indoor. Canada has been ahead of all other G7 countries and most other countries in the world in terms of two-dose vaccination. 90% of all adults in Canada have received two doses, but only 60% of adult Canadians have received a third dose, putting us behind all other G7 countries except for the United States. La santé publique du Canada calcule que si nous augmentons de 60 à 90% la proportion de Canadiens à jour dans leur vaccination au cours des prochaines semaines, nous pourrions réduire de 90% l'hospitalisation COVID à la fin de l'automne ou au début de Cela donnerait un sérieux coup de pouce à nos travailleurs de la santé qui sont fatigués et qui ont besoin de notre aide. It would also save thousands of lives. Various vaccine protection is like a phone battery. It needs to be recharged from time to time. Recharging our protection after 6 months is important. Otherwise, we are left without the power to protect ourselves and our loved ones. Au cours des prochaines semaines, à mesure que nos enfants retournent à l'école ou que nous retournons nous-mêmes au bureau, prendre un rendez-vous pour notre dose de rappel devrait être en tête de notre liste de choses à faire. Nous savons que l'immunité acquise au moyen d'un vaccin ou d'une infection diminue au fil du temps, comme la batterie d'un téléphone. Nous devons donc agir pour recharger notre niveau de protection de façon sécuritaire en restant à jour dans nos vaccinations. Si cela fait 6 mois ou plus depuis notre dernier vaccin, il est temps d'obtenir une dose de rappel. Getting everyone caught up with their vaccination is a top priority. This is not only true for COVID-19 vaccinations, but also for routine vaccinations for all children and adults. Merci, thank you, miigwech. And I would now turn, I believe, to Dr. Tam.
Merci, le ministre. Bonjour à toutes et à tous. As has been mentioned, the vast majority of Canadians have received 2 doses of COVID-19 vaccine, and many adults have received a booster. However, we know that COVID-19 immunity decreases over time, and protection from a vaccine or infection that was given more than 6 months ago no longer provides optimal protection. Being up to date with your vaccine is very important. Tenir à jour ces vaccins, ce qui comprend une dose de rappel, offre la meilleure protection contre la COVID-19 alors que l'automne approche à grands pas. Bien que l'activité de la COVID-19 diminue dans de nombreuses régions, le virus continue de circuler dans tout le Canada. Alors que les gens recommenceront à passer plus de temps à l'intérieur, nous prévoyons observer une hausse de l'activité de la COVID-19 au Canada durant les mois froids. Heureusement, nous avons mis à jour et étoffé les outils à notre disposition et une dose de rappel peut maintenant être offerte à toute personne âgée de plus de 5 ans. Canadians who have received their primary series and kept up to date with boosters have a very strong foundation of protection. The new bivalent booster, which includes the original strain of the SARS-CoV-2 virus and the BA1 subvariant of the Omicron lineage, will help build on that protection. We know that the Moderna Spikevax bivalent vaccine also generates a good immune response against the BA4 and BA5 subvariants currently circulating. If it has been 6 months or longer since your last dose or since being infected, it's time to get a booster dose. It is especially important if you're at high risk for severe illness from COVID-19. Where possible for those aged 18 years or older, that dose should be a bivalent booster that is specifically targeting Omicron. For adolescents 12 to 17 years of age at higher risk of severe outcomes for COVID-19, the booster may also be a bivalent vaccine. However, if the bivalent booster is not readily available, an original mRNA COVID-19 vaccine should be offered to ensure timely protection. Both the original and bivalent COVID-19 vaccines are effective as a booster. The simple message is having up-to-date vaccination is the key priority to restore protection that wanes over time. So the booster that is available to you is better than not being up to date with your vaccine protection. We know that involving communities and ensuring they have the credible information and tools they need to help increase vaccine uptake will be key to successful fall vaccination campaigns. The Public Health Agency of Canada will continue to support healthcare providers and community organizations, including providing funding for innovative projects to make information accessible and boost vaccine confidence. Je cède maintenant la parole à la Dr. Laura Sauvé, spécialiste des maladies infectieuses pédiatriques de la Société canadienne de pédiatrie, qui parlera de l'importance de la vaccination, en particulier au moment où les enfants retournent à l'école et font plus d'activités intérieures. Thank you. Merci. Miigwech.
Thank you very much, Dr. Tam. As Dr. Tam mentioned, I'm a pediatric infectious disease specialist who works in British Columbia, caring for children with complicated infections. This last 2.5 years has been really challenging for many children and families. And importantly, many children have gotten behind on their regular routine vaccinations. More and more, we see things getting back to normal. And with that, unfortunately, we're going to expect to see the more common infections that we haven't seen much of over the last 2 years, like influenza, are going to be coming back and becoming more frequent again. But we've also noticed that we've seen reports about cases of polio in countries that haven't seen polio for many years. This reminds us that for all vaccine preventable diseases, they can come back if we don't stay on top of our regular routine immunizations. We're far better off preventing infections and keeping children healthy in the first place than treating infections that have happened. While we can't protect children against every single infection that's out there, by making sure that kids are up to date with their routine vaccines, we can prevent many of the most common and most severe infections. Immunization is one of the most important ways that we can keep children healthy. And vaccines are very safe, and there are very rarely reasons not to get vaccinated. As many of us know, some of the most important health effects of the pandemic on children in Canada have actually been the mental health, developmental, and educational impacts, especially so for children, youth, and families who face structural and psychosocial barriers to accessing care and activities even before the pandemic. It's going to be really important as we go into the fall that in order to balance safety with maximizing connection, time in school, and time with friends and peers, that children are vaccinated, both with a regular routine vaccine, but also with the COVID-19 vaccine. The Canadian Pediatric Society and pediatricians, family physicians, and infectious disease doctors from across the country all strongly recommend that children get caught up with all vaccines, including the COVID-19 vaccine that, of course, is now available for children from 6 months and up. Some families do have important questions about how vaccines work and how we can make sure that they are safe. And it's important, if you do have questions, to talk to a trusted healthcare provider about these questions, whether that's a family doctor, a pediatrician, a public health nurse, or another provider. They can often answer your questions really well. And I'd really like to thank the Minister and Dr. Tam for having me here today to talk a little bit more about why routine vaccines as well as COVID vaccines are important. Merci beaucoup, miigwech.
Merci à tous. Il nous reste vers 45 minutes pour prendre les questions des journalistes. Une question, une suivi. On commence avec la seule question dans la salle. For those on Zoom, please use the raise hand function. We'll prioritize press gallery members and we'll alternate English and French. And when you ask a question, please specify whom your question is for. Le premier sera Louis Blanc de Radio-Canada.
Bonjour, la question est pour le ministre Duclos. En quoi ce nouveau vaccin-là, d'après vous, va changer la donne dans la lutte contre la COVID-19?
Pour plusieurs raisons. Premièrement, le fait que ce vaccin, comme on l'a entendu de la Dr Tam et de beaucoup d'autres experts, est supérieur aux vaccins actuels. Les vaccins actuels sont très bons, mais le vaccin bivalent a été démontré en laboratoire comme étant encore meilleur contre, évidemment, la souche Omicron. La deuxième chose, c'est que beaucoup de Canadiens ont attendu à la fin d'été, au début de l'automne, pour recevoir leur dose de rappel et être vaccinés à jour. On sent chez les gens, ils ont attendu, l'été n'est pas la meilleure période, évidemment, pour se préoccuper de vaccination. Mais à partir du retour à l'école, à partir du retour au travail, on sent et on sait que les gens veulent se protéger, étant donné tout ce qu'on a vécu au cours des 2 dernières années et demie. Alors, on croit que la conjonction de ce désir d'être à jour en matière de protection et de cette opportunité de se faire vacciner avec un vaccin encore meilleur va permettre à beaucoup de Canadiens de faire le bon choix et d'aller se faire vacciner. Et si je peux résumer à nouveau un des résultats que j'ai pu voir au cours des derniers jours, produits par la santé publique du Canada, on parle beaucoup de pression importante sur nos travailleurs de la santé depuis plusieurs semaines et avec raison parce qu'ils sont vraiment fatigués. Beaucoup ont quitté. Malheureusement, plusieurs songent aussi à quitter au cours des prochaines semaines. Ils ont envie d'un geste d'espoir. Ils ont envie de vivre de l'espoir par rapport à ce qui va arriver au cours des prochains mois. Alors, se faire vacciner, c'est pour nous et pour eux une façon de les aider, ces travailleurs de la santé, à passer à travers les prochains mois et à protéger d'autres patients que les patients de la COVID-19. L'estimé que la santé publique produit, c'est que si on passe de 60% à 90% en matière de taux de vaccination à jour, on pourrait réduire de 90% le nombre d'hospitalisations à la fin de l'automne et au début de 2023.
Monsieur Duclos, les cas sont en baisse. On semble être entre 2 vagues. Il y a peut-être des gens qui se demandent, est-ce que ce ne serait pas le temps d'enlever certaines restrictions comme le masque à bord des trains et des avions, peut-être enlever aussi le dépistage dans les aéroports, le dépistage aléatoire. Est-ce que ça fait partie de vos plans ou c'est là pour rester encore longtemps?
Il y a 3 choses qui font partie de nos plans. Un, toujours de rendre la vie plus facile pour les gens, y compris les gens qui voyagent. L'objectif est de rendre ça le plus agréable et une source de moins de stress possible. Quand les gens voyagent, ils aiment bien voyager dans des conditions de paix et de confort. La deuxième chose, c'est qu'il faut constater qu'au cours des derniers mois, même si on n'en a pas beaucoup parlé dans les médias et ailleurs, la COVID a fait beaucoup mal. On a eu à l'été 2022 4 fois plus de décès qu'en moyenne en l'été 2021 ou à l'été 2020. Même si on croit que le variant Omicron est moins sévère, il a mené à 4 fois plus de décès l'été qui vient de passer que dans les étés antérieurs et 7 fois plus d'hospitalisations à l'été 2022 que dans les étés précédents. Et la troisième chose, c'est qu'on sait que l'automne va être difficile. Les experts nous le disent, les travailleurs de la santé le sentent déjà. Il va y avoir d'autres maladies respiratoires qui vont revenir, en plus de, comme on l'entend, des pressions à la hausse sur les cas et sur les hospitalisations. Donc, tout en maintenant un niveau de retour à la normale le plus élevé possible, on doit continuer à être prudent, entre autres pour protéger les centaines de milliers d'infirmières et les centaines de milliers de travailleurs de la santé qui ont besoin de notre aide.
Next up is Nick Boisvert, CBC.
Good afternoon. A question for Minister Duclos. People in the U.S. are soon going to be having access to vaccines that target BA4 and 5. Here in Canada, those we apparently have not even been submitted for approval with Health Canada. Can you just explain whether the government could have done more, why that communication maybe didn't happen with Moderna and Pfizer, and why we seem to now be a bit behind the U.S.?
I would very quickly turn to Dr. Tam, who may have more up-to-date information on the process regarding Pfizer. I can tell you that regarding Moderna, the announcement in the U.S. took place a day ago, so we are almost simultaneously announcing the same decision. In addition to that, we are going to receive the vaccines tomorrow, 780,000 vaccines in the country tomorrow, and we have a very solid delivery schedule for September. 10.5 million doses of Moderna will arrive in the next few weeks. So we are solidly ready for the fall vaccination campaign. That's because of two things. First, because we have had a great relationship with all pharmaceutical companies, including Moderna, obviously, which is leading to today's announcement. And second, because we have been working alongside the independent, obviously, approval process of Health Canada. We have worked independently with procurement and public and PSPC Procurement Canada, so that very soon, tomorrow, in fact, we'll be receiving the delivery of these new doses, and provinces and territories will be able to start vaccinating with the new bivalent vaccines probably as early as next week. Dr. Tam, would you want to speak more directly to what you know about the approval process for other vaccines, knowing that this is not the responsibility of PHAC, it's managed by the independent regulators at Health Canada?
Yes, merci, le ministre. Yes, I could expand on that answer. I think the really important thing to remember is that we now have potentially a range of bivalent vaccines, and they include the Omicron spike protein. So what we have that Health Canada approved and authorized does contain an Omicron strain. The US has a slightly different variety of that, but these updated or adapted vaccines are there to provide a broadened protection against different variants, and are therefore expected to help maintain optimal protection against COVID-19. I am very confident in our Health Canada colleagues and regulatory process, because they've actually reviewed clinical data from the manufacturer that demonstrated that the immune response that's elicited is better, is superior using this bivalent vaccine against the original strain, the BA1, BA2, BA4, and BA5. Just to comment on the fact that our contractual processes, once Health Canada receives submission, and I believe that some of these submissions are anticipated very shortly, including BA4-5, is that our advanced purchasing agreement does provide flexibility to access new formulations when approved and available.
How do you, and maybe this is a question for Dr. Tam, how do you manage the messaging, the public health messaging to the public when we do know, we just heard it from you now and from Dr. Sharma this morning, that the country is expecting to get applications for more up-to-date vaccines in just the coming weeks? How do you prevent people from hearing that, expecting, perhaps maybe they'll want to wait until the most up-to-date vaccine is available? I mean, what do you do to make sure that people get this vaccine that's now been approved instead of waiting for what apparently is coming?
But the important thing is timely vaccination, and that the best protection you get is to get your booster as soon as possible. And so waiting longer, has a certain risk. And as Minister Duclos has said, that based on our modeling data, if you wait too long, the impact of the booster dose is reduced. And so getting ahead of the fall resurgence is very important. And as I've said in my opening remarks, that even the current vaccine provides good protection against particularly severe outcomes, and a booster dose will enhance that. So this bivalent Omicron vaccine uses a spike that is quite different already from the original strain, and this bivalent vaccine provides good immunogenicity in a clinical trial. So I think the message is get up to date, get your booster if you haven't had anything in terms of vaccination or infection in the last 6 months.
Le prochain sera Raphaël Pirot, agence QMI. Raphaël, on ne t'entend pas. Okay, we're going to go on to Laura Osman from the Canadian Press.
Good afternoon. Thanks for taking our questions. I wanted to ask you, we're hearing from the provinces that they're expecting the very first deliveries of this new bivalent vaccine to be somewhat limited, so they're going to be beginning with those most at risk. I'm wondering again, to build on my colleague's question, people are likely not just waiting for the next version of the vaccines, the BA.5, but how long do you expect them to wait for the currently approved, the BA.1 multivalent vaccine? Do you have a sense of when there will be enough vaccine in the country that the average non-immunocompromised person might be able to get their hands on one?
Thank you, Laura. And the short answer is that supply is not an issue. We are going to receive tomorrow 780,000 vaccines of the bivalent type. Just to give you an order of magnitude, in the last few weeks, we have seen about 200,000 vaccinations per week. So 200,000 on average in the last few weeks, 780,000 delivered tomorrow to Canada, and obviously quickly sent to provinces and territories, in a total of 10.5 million in September. 10.5 million is approximately 30% of the adult population, which is enough to bridge the 60 to 90% gap that I mentioned earlier. And with the additional doses coming later, and with the doses already available, we have ample supply to vaccinate all Canadians that want to be vaccinated in the short and in the longer term. The issue is how easy, from a physical perspective, it will be for people to access the vaccination facility. So that depends on the information that people can have access to, the vaccinators, the people, the workers that will need to find in different provinces and territories for vaccination to take place. So it's both information, ease of access, proximity to where people live, how to reach more vulnerable or more marginalized communities who need more better information and sometimes just a little help, for them to find it easy and appropriate to get the protection that they need and that they deserve. So it's more of a human resource worker challenge that is significant for provinces and territories if we want in the next weeks to administer the 10.5 million bivalent doses that we'll be receiving in September.
Thank you so much. I wanted to ask you as well, you mentioned our comparatively poor booster rates for people getting a third dose. You mentioned in the summer, earlier this summer, that the federal government was going to be trying to work on some campaigns to convince people to get boosted. What can we expect to see now that these bivalent doses are going to start to arrive to encourage people to actually get them?
a national campaign will start next week. The title is Protection Wanes, Action is Required. Just like a phone battery. Your phone battery wanes, needs to be recharged for your phone to work, to have appropriate power to operate, and for your vaccination protection to be effective. So you recharge your phone battery by plugging it to the electricity. You recharge your vaccine protection by taking action and getting vaccination protection. So that's going to start next week. This is obviously a national campaign. We know that provinces and territories will continue to increase their efforts at reaching to people, speaking in terms that inform and sometimes reassure them, with community leaders, with healthcare experts like Dr. Sauvé and many others. So it's a big team effort. We are obviously there to support the effort of provinces and territories, because supporting those efforts will be key in linking the people to the vaccines.
On revient à Raphaël Pirot, agence QMI. Raphaël, we can't hear you. Can you try once more, please? OK, dans ce cas, la prochaine sera Émilie Bergeron de la presse canadienne.
Oui, bonjour, Monsieur Duclos. Avec les premières livraisons qui vont arriver rapidement, comme vous l'avez dit, qu'est-ce qui va se passer avec les vaccins qui ont été conçus là, pour la souche d'origine? À quoi ils vont pouvoir servir et comment faire pour éviter le gaspillage, ou que d'importantes quantités de vaccins là, se retrouvent à la poubelle, alors qu'il y a d'autres pays où la vaccination est moins avancée qu'au Canada?
Tout à fait. Et éviter le gaspillage est évidemment un objectif absolument primordial. C'est pour ça que depuis le début, la gestion doit se faire de manière responsable. Ce qu'on a fait, et avec un certain succès, c'est de pouvoir, comme vous l'avez suggéré, mettre à la disposition d'autres pays qui avaient moins de capacité des vaccins au cours des derniers mois. Évidemment, c'est devenu un peu plus difficile avec les mois, parce que la disponibilité des vaccins dans les pays qui, au début, avaient plus de difficultés, cette disponibilité s'est accrue de manière importante à travers le temps, mais il y a encore des pays qui ont de la difficulté à s'approvisionner en vaccins, et certainement en vaccins ARN messagers. Alors, il y aura des opportunités d'offrir ces vaccins qui sont très efficaces à ces pays au cours des prochaines semaines et des prochains mois, tout en travaillant à accroître la durée de vie des vaccins qu'on ne pourra pas donner rapidement en les entreposant de manière appropriée.
Merci. Donc, on peut s'attendre à des annonces d'envoi, j'imagine, au cours des prochaines semaines, d'envoi de vaccins qui sont présentement au Canada vers d'autres pays?
Oui, puis si vous le souhaitez, Mme Bergeron, on peut vous donner des détails séparément sur les envois qui ont été faits au cours des dernières semaines et des derniers mois.
Our next question will be Annie Bergeron-Oliver with CTV News.
Hi there. Thank you for taking our questions. My first question is just about the interval. Online, it says that the new bivalent vaccine can be given out after 4 months, but I believe Dr. Tam was saying after 6. So when exactly do you recommend getting this new shot, after either finishing your primary series of vaccine, getting COVID, or having a booster?
Yes. Yeah, thank you for the question. So with our National Advisory Committee on Immunization, we wanted to consolidate the various recommendations and make it simple. And that is, if you haven't had a booster or been infected within a 6-month time frame, it's time to get your booster. Of course, though that interval can be adjusted, but we don't advise going down below 3 months. I think if people want to get the new bivalent vaccine, you get an opportunity to do that within a sort of 3-month time frame, especially if you're at high risk. And so it is actually quite important, because we There's even more recent data published about the success of the NACI recommendations on the intervals to date, and it won't give you as much benefit if you went down below 3 months. So that's a sort of time period that provinces, as they implement their programs, will be working with. But just remember the 6 month. If you haven't had a booster within that 6 month time frame, it's been longer than that, please go and get a booster.
Okay, thank you for that clarification. And my follow-up, the health minister, as well as Dr. Tam, you both mentioned that it's going to be a tough fall. And so given that, I'm wondering what you think about Ontario's decision to remove isolation requirements for anybody who tests positive for COVID-19.
I can start and then invite Dr. Tam to provide the more policy scientific basis for how PHAC assesses public health measures. But obviously, as a health minister, I value and support very much the importance of my colleagues in different provinces and territories to make decisions which they believe to be the most appropriate ones at their level, in their conditions, and with the experience and expertise that they have accumulated over the last few months. So it will always be important for me to recognize that their decisions are anchored in their knowledge and ability to work and to serve the best the best possibly their constituents in different provinces and territories. But Dr. Tam, you may want to add or may not need to add anything to that.
Yes, thank you for the question. I think I always advocate for the vaccine plus approach, which vaccine forms a key foundational layer of protection. But please consider layering on masks, staying home if you're sick, and of course, maximize ventilation, optimize it as much as you can. I think on the key layer of staying home with sick is what Ontario is trying to implement. I would just say that from a factual, scientific basis, people have to remember that if you get infected, you can still shed the virus for quite a number of days, and it could be as long as 10 days. So you got to really be careful, even if you're leaving your home, leaving isolation, if you know you've been infected, take all other layers of precaution, wear a mask, especially if you're going to be in contact with others and at high risk.
We say third time is a charm, and with that, on revient à Raphaël Pirot de QMI.
Oui, allô? Est-ce que vous m'entendez?
Oui.
Wouhou! Hey, merci tout le monde. Merci, Dylan, pour ta patience. Merci, M. Duclos aussi. Écoutez, ma question, c'est sur les tests aléatoires. Il y a des gens qui reçoivent leurs tests en retard, donc plus tard qu'une semaine. La période d'isolement en cas de test positif, évidemment, c'est 10 jours. Et ça arrive surtout avec les personnes qui prennent la trousse à distance, qui veulent faire le test à la maison, et ce qui représente environ 40% des gens. Donc, il y a beaucoup de gens qui reçoivent leurs résultats en retard. Est-ce que vous considérez ça comme un raté du programme? Est-ce que c'est pas un peu je sais que c'est aussi pour la détection des variants, mais est-ce qu'il y a pas un problème là dans l'exécution?
Mais merci, Raphaël, et bravo d'avoir réussi à vous connecter. La chose importante, comme vous l'avez suggéré, c'est de comprendre l'objectif de ce programme. L'objectif de ce programme, ce n'est pas de fournir des tests et des résultats de tests à un niveau individuel, c'est de comprendre au niveau agrégé le type d'importation du virus que l'on peut voir au pays. Donc, ce n'est pas pour dire aux gens s'ils sont positifs ou négatifs, c'est pour que l'Agence de santé publique puisse savoir, parce qu'il y a plusieurs centaines, plusieurs milliers de tests qui sont faits à tous les jours, puisse savoir la quantité de positivité à la COVID qui rentre au pays, d'où ça vient, avec quel type de variant ou de sous-variant et de quelle manière ça varie selon l'origine, la provenance des gens qui rentrent au pays. Donc, c'est un exercice scientifique, statistique, qui n'a pas comme objectif de donner aux gens des résultats sur leur statut individuel. Les gens, lorsqu'ils pensent être malades, utilisent généralement des tests rapides pour pouvoir le savoir. Les tests rapides sont facilement disponibles dans les pharmacies et ailleurs. Donc, ils ont accès maintenant depuis plusieurs mois à des outils appropriés à leurs circonstances individuelles pour connaître leur statut d'infection ou non et de prendre des actions conséquentes. Et Dr. Tam, si vous souhaitez ajouter à ce que je viens de dire, bien, vous êtes la bienvenue.
Non, vous avez donné une très bonne réponse. Merci.
D'accord, merci beaucoup. Ma deuxième question, en fait, c'est en suivi. L'affaire, c'est que il y a à peu près 5000 tests. Je pense que l'Agence de la santé publique veut tester presque 5000 personnes par jour. C'est ça l'objectif. Est-ce qu'il n'y a pas un rapport coût-bénéfice peut-être à refaire de ce côté-là? Le prix, déjà, le coût de la mesure, la réponse que j'ai eue de la santé publique, c'est qu'on n'était pas en mesure de l'établir encore. Mais 5000 tests par jour, avec toute la logistique que ça comporte, il n'y a pas d'autres moyens, justement, comme par exemple la détection des eaux usées, qui est une autre technique pour détecter combien ou la présence, faire un breakdown des variants qui circulent en ce moment, sachant aussi que les variants qui entrent au pays, ben, c'est pas avec cette mesure-là nécessairement qu'on va les freiner. Donc, juste par rapport au coût-bénéfice de cette mesure-là, est-ce que c'est quelque chose que vous voulez remettre en question peut-être pour l'automne?
Excellente question, Raphaël. Et bon, mon bagage statistique va m'amener à en dire un peu plus que peut-être que je devrais le faire. Je devrais peut-être me tourner tout de suite vers la Dr. Tam. Mais si vous me permettez, il est clair que l'Agence a la responsabilité de revoir continuellement ces mesures en tenant compte, comme vous l'avez dit, des avantages de ces mesures, mais des coûts aussi qu'il y a à mettre en place ces mesures, des coûts évidemment pour le gouvernement, mais aussi les coûts pour les gens, parce que les gens qui se font tester, même si c'est une faible proportion, ben, doivent consacrer du temps et des efforts à faire le test. Et donc, ça fait partie des coûts totaux dont l'Agence a absolument besoin de tenir compte. Ceci étant dit, il n'y a pas beaucoup d'autres façons de procéder pour avoir des résultats précis selon la provenance des gens, et avoir des taux de positivité précis en fonction d'où exactement les gens sont. Parce que, et ça, je vais inviter la Dr. Tam à donner plus de précisions, parce que même si on fait des progrès importants sur l'usage des données de type eau usée, et ça va assez vite en termes de progrès, ces méthodes basées sur des taux usés sont des méthodes qui ne permettent pas de donner autant de précision que des tests basés sur des circonstances individuelles de gens qui rentrent au pays. Toutefois, avant de passer à la Dr. Tam dans quelques secondes, j'ajouterais que la santé publique, ce qu'elle fait aussi, c'est de travailler de plus en plus étroitement avec les autres pays qui, eux aussi, développent des techniques alternatives à des tests PCR et avec lesquels, par conséquent, on doit accroître notre collaboration parce que les mouvements de voyageurs entre ces pays et le Canada mènent à des importations de COVID-19 qui sont évidemment mieux compris et mieux traités lorsqu'on connaît les situations des pays dans desquels les gens viennent lorsqu'ils arrivent au Canada. Dr. Tam, si vous souhaitez ajouter quelque chose sur le travail que fait l'agence, travail continu et important de sous-peser à la fois les coûts et les avantages de différentes façons de suivre l'importation de la COVID-19 au Canada.
Merci beaucoup. Vous avez donné encore un très bon réponse très compréhensif. Donc, selon moi, c'est important de réexaminer les objectifs et les manières de donner les mesures de santé publique fréquemment. Donc, c'est vrai, nous sommes en train de réexaminer notre protocole. Mais le niveau de souche entre 4000 et 5000, c'est le niveau pour détecter les variants importants, par exemple, le pays de provenance. Donc, c'est un niveau de souche assez important. Et donc, mais le système en train de développement aussi est le système de l'eau usée. Mais maintenant, c'est pas possible d'utiliser ce système pour détecter le pays provenant, par exemple. Dans un aéroport. C'est vraiment difficile. On n'a pas la méthode pour trouver c'est quelle personne qui excrée, est-ce que c'est le mot, le virus dans un aéroport. C'est peut-être un sujet domestique aussi, parce que beaucoup de personnes visitent un aéroport. Donc, ce système n'est pas suffisant maintenant pour donner quelques connaissances. Mais nous sommes en train de, comme toujours, d'examiner est-ce que c'est toujours la méthode importante maintenant.
Thank you. We have just about 15 minutes and 6 questions, so we'll try to hit up as many as we can. Next up is Marcia McLeod with the Globe and Mail.
Hi there. Thanks for taking our questions. My question is from Minister Duclos. You said a few minutes ago that Canada and the US are, quote, almost simultaneously announcing the same decision regarding these bivalent vaccines. The US has announced the availability of the vaccine targeting the BA4 and BA5 subvariants, and we've approved, obviously, the BA1 targeted version. Could you just clarify what you meant, saying, you know, that we've made the same decision as the US?
Well, first, the same decision on Moderna, one day apart. Second, as Dr. Tam will make even more clear in a moment, now those bivalent vaccines all target Omicron. Now, Omicron is a family now of subvariants which resemble each other and are quite different from the original Wuhan strain. So that's why they share this in similarity. It's like different brothers of the same family. The Omicron family, very, very much related in terms of the actual biological structure. So all of that means that those different type of bivalent vaccines, all related to Omicron, share lots of similar things. But for that to be more precise, let me turn back to Dr. Tam.
Yes, I think every country is trying their hardest to update the current vaccines. And we are actually quite aligned, for example, with the European decisions. The EMA made their announcements today on the BA1 Omicron bivalent vaccine, very similar to us as well. And I think the United Kingdom and others have gone the same path. I think we are always interested in our American colleagues and their data and what has been submitted to them, but we have to make sure that Health Canada receive the information and that it go through the rigorous process. What I can say is that we do have clinical information from Moderna for the Omicron containing updated vaccine, which shows that the immune response in the people vaccinated shows a good immune response to BA4 and BA5 as well.
Thank you. And just as a follow-up, when could Canadians expect to see a bivalent vaccine that specifically targets BA4 and BA5 here in Canada?
I think, of course, we have to let Health Canada do their job. The company has to submit, and we believe that's will be quite soon, the submissions, but it is the companies that have to do that. And Health Canada colleagues are in a very close communication with the FDA, certainly right now finding out more about the decision making and the data that they have to make that decision. And just to emphasize that in the NACI, our National Advisory Committee on Immunization, already made a recommendation at the same time as Health Canada authorized the vaccine in the United States. They are still deliberating, I think, through their NACI equivalent, exactly what the recommendations would be, and that's happening right now.
Next up is Adam Miller with CBC.
My question. How effective do you think the BA.1 bivalent vaccines will be against transmission, particularly of the dominant BA.4 and BA.5 variants, you know, in the real world based on the available data you've seen?
We do not know what the real world impact is because that is not available. In the Moderna vaccine, we know from the clinical information of the people vaccinated in the clinical trials that the neutralizing antibody boost is quite significant. Certainly, it's the level of the neutralizing antibodies boosted against the original strain BA.1, BA.2, BA.4, and 5. So that's a good range of coverage. It is possible that as more data becomes available, we'll see some difference between these different types of updated vaccines, but we don't have that yet. But I think you brought up a really good point in that what they may in fact boost is with the level of neutralizing antibodies is the protection, at least for a period of time, maybe through the 4 months, a protection against infection and transmission. So that we hope to see will be boosted.
Okay, and thanks for that. And my follow-up question is, you know, I asked Dr. New this morning what our plan is moving forward with these vaccines. I guess my question for you is, what will happen with the original COVID vaccines when Canada switches over to these bivalent vaccines? Are they going to expire? Will they still have some use in the future? And yeah, what exactly are we going to see, you know, happen with these original vaccines?
Shall I take that first, Minister Duclos?
Yes, please do so, Dr. Tam.
Yes, so I think the National Advisory Committee on Immunization essentially is advising that the new bivalent booster is provided to people 18 plus and also 12 to 17 years if they're high risk medical conditions. So I think that with the quite a large supply of vaccines coming on board in September, that switch will occur throughout this month. So it is important to minimize wastage and as much as possible, if we don't need the vaccine, of course, not to acquire more of it and to be able to provide it if it's useful to others. But it does mean that some of them likely won't be used. But we do still have to minimize any potential wastage.
And I would add to that very briefly that avoiding as much as possible wastage is clearly a key objective. At the same time, we want to be certain that Canadians have access to the best vaccines possible. I spoke earlier about the potential and hopefully probable impact on hospitalization that our vaccination campaign in the fall may have. Just to give you a number, on average, some hospitalization due to COVID-19 costs about $23,000. $23,000 is obviously a lot of money, but in addition to that, our healthcare system and our healthcare workers are burdened with COVID-19 and many other issues. So vaccination has been key and will remain a key tool in protecting Canadians. So although we will at all costs avoid wastage, we will make sure that Canadians have access to the best possible vaccine so they can protect themselves and protect others.
We've got 7 minutes. We'll try to get as many as we can. Next up is Alex Boyd with the Toronto Star.
Hi there. Thanks for taking questions. We've heard a lot today, obviously, about having to keep our vaccines updated as we go. Ontario scrapping their isolation policy. Wondering if these are signs that we are now treating the pandemic more as endemic, and if so, how that changes the management approach at the federal level. Could we see some of these restrictions begin to phase out federally as well?
Well, there are two components to that. First, whether COVID-19 is becoming endemic, and we'll turn to that in a moment to Dr. Tam. And second, what policies could be changed at the federal level. On that second point, as you've seen over the last few months, and as you will see over the next few weeks, depending on the situation, we always adjust our policies based on what we know, but also on the prudential approach to the management of COVID-19, which has helped save tens of thousands of lives and hundreds of thousands of hospitalizations compared to what we would have seen had the pandemic been managed differently. But on the science part, let me turn to Dr. Tam.
Yes, I mean, I think there's lots of ways that people want to define what an endemic state is, and some of it includes what is it now getting into a more predictable pattern? Is the R level, the reproduction number, just hovering around 1? There's all these different kind of ways of thinking about it. And is it more manageable? But I think I would prefer to think about it as certainly ongoing management of this virus. It is not leaving the human population anytime soon. The summer wave tells us that it's not entirely predictable. You know, we can't just say we expect it every year in a certain period of time in the winter, and then prepare for that kind of ongoing management. It may settle down. I think it would be nice to have another look at that after this fall. And then, of course, the next months will let us know whether the virus is becoming more predictable. At the same time as moving towards that state of ongoing management, some of it is not really scientific. It's about how to get everyone in Canada into thinking about managing to deal with the virus and indeed other viruses by taking up regular habits. So regularly updating the vaccine, regularly wearing a mask as needed based on viral activities in the community. These personal protective habits is what we would want to develop, and we can again reinforce that over the fall and winter months.
Thank you. Next up is Karen McKinley from the Brandon Sun.
Well, good afternoon. And actually, this is more about fourth dose. We're talking a lot about boosters, but in terms of Manitoba, they were back in July, they said they were not going to open up eligibility for fourth dose until the bivalent vaccine may or may not become available. Now that it's here, we're still waiting on word if they're going to open up eligibility, but just considering all the messaging we've heard about getting your booster as quickly as possible, does that apply to also people who have made it more than 6 months for their fourth dose, or should they be taking the advice of Dr. Roussin and maybe waiting until those who say are immunocompromised get theirs?
Thank you for that question. And so the NACI advice, which has been really simplified, I would say, and it's been great, is that if you haven't had a dose in 6 months, you should get another one. And the bivalent vaccine will become quite available, I mean, in very reasonable amounts within the month of September. And in the meantime, of course, if you're offered the current booster, you can still take that, but within the month of September, there should be a good supply of the bivalent vaccine for the provinces and territories. And NACI doesn't take into account how many previous boosters you've had. Is that interval? And if it's been longer than 6 months, then go and get a boost.
Okay, thanks for that. And because it was, the reasoning then, it was because a large fourth dose campaign could have delayed the receipt of a better vaccine. Now, with this vaccine coming, you're saying that no matter what, the bivalent will be available to all provinces that want it.
That's correct, and it would be as usual distributed in a as a matter of principle, a sort of per capita approach. But also the rate at which that vaccine is being consumed will also be taken into account, given that we don't want any wastage. But maybe I'm just trying to understand your question a little bit better. But some people, I think, were worried that, well, if I just got my dose in July, can I get another bivalent dose? And people are worried about, well, shouldn't we all wait until the bivalent vaccine's available? And I think NACI also give that flexibility to the provinces and territories so that the interval can be 3 months. Like if you're at high risk, you got your dose 3 months ago and the bivalent vaccine is available, you shouldn't be necessarily denying that dose. You can have that flexibility.
Yeah, thank you.
Thank you. We've got one more question on the line. I don't know if the minister has a moment for one more question. I'm going to open up the line for one question, no follow-up, for Stephanie Dubois from CBC Edmonton.
Hi there. My question is for Mr. Duclos, since the procurement minister isn't here, but I'm wondering if there was an additional cost to Canada to have the 6 million doses of the Moderna's original vaccine converted to the BA1 bivalent vaccine that was announced today.
Well, to be certain you've got, and you deserve to have that, the right information you will need, and we will help you speak to my new colleague at PSTC. She will know exactly the procurement process. However, what I can tell you, as Dr. Tam said earlier, is that we have had a lot of flexibility in the use of the procurement contracts that we have signed. So I expect that flexibility also to be shared with you when you speak to her office.
Thank you, Minister, and thank you to the doctors for joining us today. We really appreciate you taking our questions.
Thank you very much for your great work, Dylan, and everyone have a good day.